Are you worried about your bone health? Are you looking for an effective way to defy osteoporosis? Look no further because we have the answer for you: Fosamax. With its unique mechanism of action, Fosamax safeguards your bones from the detrimental effects of osteoporosis. Fosamax, a widely prescribed medication for osteoporosis, works by inhibiting the activity of osteoclast cells, responsible for bone breakdown. By doing so, Fosamax effectively decreases bone loss, strengthens bone density, and reduces the risk of fractures. But what sets Fosamax apart from other osteoporosis treatments? Unlike other medications, Fosamax can be taken orally, making it convenient and easy to incorporate into your routine. Additionally, Fosamax has proven to be highly effective, with clinical studies demonstrating a significant reduction in fractures and an improvement in bone mineral density. So, if you want to safeguard your bones and defy osteoporosis, Fosamax is the solution for you. Talk to your healthcare provider today to see if Fosamax is right for you. Don't compromise on your bone health, take action with Fosamax. Understanding the mechanism of action of Fosamax. Fosamax belongs to a class of medications called bisphosphonates, which are specifically designed to target the bone tissue. The main active ingredient in Fosamax is alendronate sodium. When taken orally, Fosamax is absorbed into the bloodstream and reaches the bones, where it exerts its mechanism of action. Fosamax works by inhibiting the activity of osteoclast cells, which are responsible for breaking down old bone tissue. Osteoclasts play a vital role in the bone remodeling process, where old bone is resorbed and new bone is formed. However, in individuals with osteoporosis, the activity of osteoclasts is increased, leading to excessive bone breakdown and a decrease in bone density. By inhibiting osteoclast activity, Fosamax helps to rebalance the bone remodeling process. This leads to a decrease in bone loss and an increase in bone density. As a result, Fosamax helps to strengthen the bones and reduce the risk of fractures. How Fosamax safeguards bones. Fosamax safeguards bones by targeting the root cause of osteoporosis, excessive bone breakdown. By inhibiting osteoclast activity, Fosamax helps to restore the balance between bone resorption and bone formation. This is crucial for maintaining healthy bone density and strength. Furthermore, Fosamax not only prevents further bone loss but also promotes the formation of new bone tissue. By stimulating osteoblast cells, responsible for bone formation, Fosamax encourages the deposition of new bone, leading to an overall improvement in bone health. In addition to its direct effects on bone cells, Fosamax also plays a role in regulating calcium metabolism. Calcium is an essential mineral for bone health, and Fosamax helps to ensure that an adequate amount of calcium is available for bone formation. This further contributes to the safeguarding of bones and the prevention of osteoporotic fractures. The role of Fosamax in defying osteoporosis. Osteoporosis is a condition characterized by a decrease in bone density, leading to fragile and brittle bones. This puts individuals at a higher risk of fractures, especially in areas such as the hips, spine, and wrists. Osteoporosis is more common in postmenopausal women due to the decline in estrogen levels, but it can also affect men and individuals of all ages. Fosamax plays a crucial role in defying osteoporosis by preventing further bone loss and improving bone density. By inhibiting osteoclast activity and stimulating osteoblasts, Fosamax helps to restore the balance between bone resorption and formation, thereby strengthening the bones and reducing the risk of fractures. Numerous clinical studies have demonstrated the effectiveness of Fosamax in defying osteoporosis. These studies have shown a significant reduction in the incidence of fractures in individuals taking Fosamax compared to those on placebo. Additionally, Fosamax has been shown to improve bone mineral density, further highlighting its efficacy in treating osteoporosis. Benefits and effectiveness of Fosamax in treating osteoporosis. The benefits of Fosamax in treating osteoporosis are manifold. Firstly, Fosamax is highly effective in reducing the risk of fractures, which is a major concern for individuals with osteoporosis. Clinical studies have consistently shown a significant decrease in fracture rates in individuals taking Fosamax compared to those not on treatment. Secondly, Fosamax improves bone mineral density, which is a key indicator of bone health. By increasing bone density, Fosamax helps to strengthen the bones and reduce the risk of fractures. This is particularly important in individuals with low bone density, as it can help to prevent further bone loss and promote bone remodeling. Furthermore, Fosamax has a convenient dosing schedule, making it easy to incorporate into daily life. Unlike some other osteoporosis medications, which require frequent injections or infusions, Fosamax can be taken orally once a week or once a month. This makes it a more convenient option for individuals who may have difficulty with other treatment modalities. Potential side effects and precautions of Fosamax. While Fosamax is generally well tolerated, like any medication, it can have potential side effects. Common side effects of Fosamax include gastrointestinal symptoms such as heartburn, stomach pain, and nausea. These symptoms can usually be managed by taking Fosamax with a full glass of water and remaining upright for at least 30 minutes after ingestion. Rare but serious side effects of Fosamax include osteonecrosis of the jaw and atypical fractures of the femur. Osteonecrosis of the jaw is a condition where the bone tissue in the jaw fails to heal after a minor injury, leading to pain, swelling, and infection. Atypical fractures of the femur are uncommon but can occur in individuals taking Fosamax for a prolonged period. To minimize the risk of these serious side effects, it is important to follow the recommended dosing and administration guidelines for Fosamax. It is also essential to inform your healthcare provider about any pre-existing conditions or medications you are taking, as they may affect the safety and efficacy of Fosamax. Dosage and administration guidelines for Fosamax. The dosage and administration of Fosamax depend on the individual's specific needs and the severity of their osteoporosis. Fosamax is available in both weekly and monthly dosing regimens. For weekly dosing, Fosamax is typically taken on the same day each week. It should be taken in the morning, at least 30 minutes before the first food, beverage, or medication of the day. Fosamax should be swallowed whole with a full glass of plain water and should not be chewed, crushed, or dissolved. For monthly dosing, Fosamax is taken on the same date each month. The administration instructions are the same as for weekly dosing, with the exception that Fosamax is taken once a month instead of once a week. It is important to strictly follow the dosing and administration guidelines for Fosamax to ensure optimal efficacy and minimize the risk of side effects. Your healthcare provider will determine the appropriate dosage and schedule for you based on your individual needs and circumstances. Fosamax versus other osteoporosis medications. Fosamax is just one of many medications available for the treatment of osteoporosis. Each medication has its own unique mechanism of action, benefits, and potential side effects. The choice of medication depends on various factors, including the individual's overall health, preferences, and treatment goals. Some other commonly prescribed medications for osteoporosis include resedronate, Actonel. Like Fosamax, resedronate belongs to the bisphosphonate class of medications. It works by inhibiting osteoclast activity and reducing bone loss. Resedronate is available in both daily and monthly dosing regimens. Denosumab, Prolia. Denosumab is a monoclonal antibody that targets a protein called rank ligand, which is essential for osteoclast formation and activity. By inhibiting rank ligand, denosumab helps to decrease bone resorption and increase bone density. Denosumab is typically administered as an injection every 6 months. Raloxifene, Avista. Raloxifene is a selective estrogen receptor modulator, SERM, that mimics the effects of estrogen on bone tissue. It helps to prevent bone loss and reduce the risk of fractures. Raloxifene is taken orally on a daily basis. The choice between these medications depends on various factors, including the individual's specific needs, preferences, and medical history. Your healthcare provider will work with you to determine the most suitable treatment option for your osteoporosis. Frequently asked questions about Fosamax. Can Fosamax be taken with other medications? Fosamax can interact with certain medications, including calcium supplements, antacids, and other oral medications. It is important to inform your healthcare provider about all the medications you are taking to ensure their compatibility with Fosamax. Can Fosamax be taken during pregnancy or breastfeeding? Fosamax is not recommended for use during pregnancy or breastfeeding. It is important to discuss alternative treatment options with your healthcare provider if you are pregnant or planning to become pregnant. How long do I need to take Fosamax? The duration of Fosamax treatment depends on your individual needs and the severity of your osteoporosis. Your healthcare provider will determine the appropriate duration of treatment based on ongoing monitoring of your bone health. What should I do if I miss a dose of Fosamax? If you miss a dose of Fosamax, take it as soon as you remember, unless it is less than 12 hours before your next scheduled dose. In that case, skip the missed dose and continue with your regular dosing schedule. Do not take 2 doses at the same time. Can Fosamax be used in men with osteoporosis? Yes, Fosamax can be used in men with osteoporosis. Osteoporosis can affect men as well, although it is more common in women. Fosamax has been shown to be effective in reducing the risk of fractures and improving bone density in men with osteoporosis. Conclusion and final thoughts on Fosamax's mechanism of action. Fosamax is a highly effective medication for the treatment of osteoporosis. Its unique mechanism of action, which involves inhibiting osteoclast activity and promoting bone formation, helps to safeguard bones and defy the detrimental effects of osteoporosis. With its convenient oral administration, Fosamax can be easily incorporated into daily life, making it a practical choice for individuals seeking to improve their bone health. Clinical studies have consistently demonstrated its effectiveness in reducing fracture risk and improving bone mineral density. As with any medication, it is important to discuss the potential benefits and risks of Fosamax with your healthcare provider. They will consider your individual needs and circumstances to determine if Fosamax is the right treatment option for you. Take action today to safeguard your bones and defy osteoporosis with Fosamax.